Welcome, and thank you for joining us for Efficient Times Self-Care Snippets. Your host is Dr. Jacquetta, your self-care specialist. The information in these self-care snippets is not to be construed as medical advice or diagnosis. Before making any drastic changes in your medical lifestyle, check with your physician. As a self-care specialist, Dr. Jacquetta helps us discover and use the 5 pillars of self-care, which are nutritious food, clean water, fresh air, exhilarating exercise, and rejuvenating rest to build a healthy lifestyle. She also helps us examine our attitude, environment, and support systems. So let's join Dr. Jacquetta as we go into this Efficient Time Self-Care Snippet.
Greetings. This is a self-care snippet on oral health care. I want to start by reading a text message I received from my sister. She said to us, "I'm in my car reeling from this 3.45-hour root canal on tooth number 2. It was horrendous. Roots were calcified, could only get 3 fully, and the 4th was worked on for over an hour and a half. Stopping to do an ultrasound and later another x-ray. At the 3-hour mark, I screamed, didn't know it was coming, because the Novocaine had begun to wear off. Eventually, a second opinion was requested from the big cheese. The tooth, number 2, the one they were working on, needs to be extracted along with number 3, the one I was having extracted next week. I wasn't even charged for the work today." This is a similar story to one of my BFFs. They hadn't been taking care of their teeth. They hadn't been going to the dentist for years. They weren't getting regular cleanings. They weren't getting, I don't know if they were having pain in their teeth, but they weren't getting their teeth taken care of. So that's what we want to talk about today. I want to talk about dental hygiene, health care, and now, mind you, I am not a dentist. So what I did when my sister sent that text to us, the siblings, I did some research to find out what we can do to keep our teeth healthy. And we think of the obvious things, brush your teeth, floss your teeth, but there are some things that we can actually do to make our teeth healthier than they normally would be. And even if they're in a condition right now where they're starting to decay, you can actually remineralize your teeth. So first, what I want to talk about are the issues that can arise when we don't take care of our teeth. The main problem is the bacteria that forms on the teeth. That's the common factor in most of all of the disease that comes from our oral health issues. One thing that can happen is cardiovascular disease. The same bacteria that's in your teeth can come through your bloodstream and get into your bloodstream goes through your body and it gets into your heart, and it can actually cause some problems with your heart. It forms plaque in your arteries, and the arteries start to harden, which is called atherosclerosis. And this hardening can lead to blockages, which can lead to a heart attack, or simple hypertension, which is never actually simple, and it can lead to strokes. So cardiovascular disease is one issue to look for. It can also lead to dementia. The bacteria can go into the brain and start to kill the brain cells, which causes us to lose memory. That can take place. Respiratory infections can take place. The bacteria in the teeth and gums can actually be breathed into the lungs, or it can travel through the bloodstream and cause bronchial arthritis and other respiratory infections. It can also cause diabetes. Now, diabetics are automatically more susceptible to infections than most people are. So what happens is the inflammation in the mouth decreases the body's ability to use insulin, and it weakens the body's ability to control the blood sugar levels. So That's one thing to look for also. Complications with pregnancy. Hormonal changes can cause a woman to develop oral infections more easily. Any infection can increase pregnancy complications. Oral health problems can lead to premature births and low birth weight. So both the baby's health and the mother's health are in jeopardy if oral health problems occur. Also, the baby takes many of the nutrients that the mother needs for her body, because the baby is forming all new body parts. So the baby is forming muscle, is forming ligaments, forming bones. So all the calcium, the magnesium, all the minerals, the vitamin D that's necessary for a baby to form, the baby starts to take that away from the mother. If the baby is forming healthily, the baby is going to take that away from the mother. And that's why more women get cavities when they're pregnant. So that's all of these issues arise during a pregnancy, and that's all the more reason to take better care of your teeth. Arthritis is another one, and that's due to the inflammation. Now, inflammation, when there's dis-ease in the mouth, the gums become inflamed, and that inflammation, if it's in the mouth, it's also in other parts of the body, and it's a common factor in inflammatory diseases, including allergies, asthma, autoimmune diseases, hepatitis, and rheumatoid arthritis, and that's just to name a few. Other diseases that can be caused by oral bacteria are infertility. That surprised me. Erectile dysfunction, cancers, and kidney disease. So take care of your teeth. Dentists recommend that you brush your teeth and gums for at least 2 minutes every time you eat. Floss your teeth daily. Avoid smoking and chewing tobacco. Limit sugary foods and drinks. The sugar feeds inflammation, so any sugar that you eat is going to feed inflammation, even if it's not processed. The natural sugars also feed inflammation. Eat a well-balanced, nutrition-filled diet. Now, I had to do some research when I talked to my sister, because whenever I talk to somebody about their issues or concerns, even if it's not something I'm going to do anything about or do anything with, that information causes me to want to find out what we can do to fix the problem, what we can do to make ourselves stronger. So I looked up what kinds of foods are antibacterial. And when you look it up, you might also find that it's antibiotic. Honey, garlic, turmeric, coconut oil, lemon, pineapple, ginger, oregano, and horseradish are all antibacterial foods. The anti-inflammatory foods I looked up are turmeric and ginger, sprouting broccoli, tomatoes, berries, salmon, garlic, whole grains, dark leafy vegetables, nuts, peppers, beets, olive oil, and tart cherries. Not only did I want to see what foods we could eat to help take care of the problem once the problems arise, but I also wanted to see what my sister could do to prepare for her next dental visit. She was already getting the root canals. She already had an appointment to go have her other teeth pulled. I wanted to see what she could do to strengthen her teeth and gums in the meantime. What I found out was that there are actually diets you can go on to heal cavities and improve your oral health. Now, I didn't know that cavities could actually heal, so I'm passing that on to you. one woman actually I saw many accounts of different people who had already healed their cavities, and what I found in common were that they said to stay away from foods that contain phytic acid. Now let me tell you a little bit more about phytic acid. Phytic acid is an anti-nutrient, and it actually goes in and snatches up the nutrients in the digestive system and prevents them from being digested. So it's not even going into your bloodstream. It's going directly from your mouth down into your digestive system, and then it just takes away the nutrients. High phytic acid foods include oatmeal, whole grains, nuts, beans, and legumes. Bananas, by the way, are legumes, so keep that in mind. So even though I said on the other list that nuts and grains are anti-inflammatory foods, if you're working toward healing your cavities, healing your mouth, then don't indulge in those particular anti-inflammatory foods. In addition to avoiding phytic acidic foods, limit foods containing even natural sugars. So even though apples and oranges and pineapples were on the list of antibacterial foods, berries were on the list of anti-inflammatory foods, if you're working toward eliminating dental caries, healing cavities, and improving your oral health, if that's your mission at the moment, stay away from even those foods. Include a lot of healthy fats into your diet, including coconut oil, pastured and cultured butter. Avocados are a healthy fat that you can engage in. Also, bone broth. That's taking beef bones and boiling them in water and drinking the broth from them so that you actually get the minerals that are in those bones, and it helps in your bones. Now, I would have thought that wouldn't work so well, especially since a lot of the nutrients we're supposed to get from meat, we actually don't get from meat because our bodies are working so hard to process the meat that we're not getting the benefit of the nutrients. But evidently the minerals in the bone broth, once it boils out of the bones, is beneficial to our bodies. Now, those are what we can do in our diet as far as the foods are concerned. The supplements we can take are fermented cod liver oil and butter blend. I'm putting the web address for this information on this YouTube page so that you can see it. It gives you recipes like the bone broth. It actually tells you how to prepare the bone broth. And the fermented cod liver oil and butter blend, it gives you a recipe for preparing that. Another supplement that we need to increase is vitamin D. Cavities heal even when the diet wasn't changed, but vitamin D was introduced into the diet or increased in the diet. And especially if the diet changed and vitamin D was introduced, then there was definitely an increase in oral health. Coconut oil, we already mentioned that. Organic, virgin, and unrefined coconut oil is best. And other supplements include magnesium, gelatin, and vitamin C. Other factors that can be included in your regimen to remineralize your teeth include a remineralizing toothpaste. Now, there's a link for doing that. This particular person gives a recipe for how she remineralized her teeth, and she says daily she's swished with both calcium and magnesium powders dissolved in water to help provide minerals and keep her mouth alkaline. Now, that's another issue to consider. We need to keep our bodies more alkaline. So make sure you drink a lot of water, alkaline water. to help flush out some of the acidic properties that we're getting from the food we eat every day. Because in an acidic environment, that's when we start to see dis-ease. But dis-ease cannot live in an alkaline environment. She also added Aura Wellness Brushing Blend. There's a link to that. And activated charcoal. Activated charcoal is sold. I've seen it on Amazon. I actually used to have some. I think I got mine on Amazon. And she also practiced oil pulling daily. Now, oil pulling, I had to look that up. You put the oil in your mouth and you swish it around. I think she said for about 2 minutes until it actually becomes white. And she tells what types of oils to use, but go to the link, look that up. If you want to, if you're really in serious need of remineralizing your teeth. That is my self-care snippet for taking care of your teeth. It's imperative that we take care of our teeth because our teeth are imperative for chewing our food. And if we don't chew our food, we don't get the benefit from our nutrients. That is this week's self-care snippet. Be sure to subscribe to our YouTube page so that we can keep you updated. Unfortunately, we're not able to go live until I think it's 100 subscribers. So I'm looking for you all to subscribe. Also, like us on Facebook. I invite you to make self-care your priority. Shemotep.